That's okay.
If you want to start,
Yeah, will I go without the slides? What you can imagine on the screen is there's a big blue slide that says more care, better health. And I'm going to go ahead, do it without the slides, and then we can share the slides after if anyone's interested in receiving them. How does that sound? Great, thank you for the thumbs up. So good morning, ladies and gentlemen. My name is Rafferty, and I'm the Business Development Manager for Low and Middle Income Countries at ABI. ABI is a telehealth platform, and I'm presenting our abstract here today entitled Telehealth Initiatives in Conflict Zones, Insights from the Ukraine. So to contextualize our research, it's important to first understand that there's a global dearth of healthcare professionals in the world. The UN estimates that by 2030, there will be a lack of healthcare professionals to the sum of 18 million globally. And that's even more acute when you look at the difference between low-income and high-income countries. In low-income countries, 12% of the world's population have access to just 1% of the world's healthcare professionals. And even more profound is when you look at that on an initiative, on a level of conflicts and in conflict-based regions. In the first year of the full-scale invasion by Russia in the Ukraine, there were 334 direct attacks on healthcare facilities. So that begs the question, how can digital healthcare be leveraged to ensure continuity of care, i.e. the resilience of healthcare systems for people in conflicts such as that of the Ukraine? I work for ABI, and ABI is a telehealth company that makes professional healthcare as easy to access as advice from a friend. We're an accessible and scalable platform because we're user interface agnostic. We meet people where they are. And what we do is we use artificial intelligence to do three key things. The first is we take the paradigm of appointments and flip it on its head. In a traditional healthcare setting, you'll present at a healthcare clinic or in traditional telehealth, and you'll go to see a healthcare professional, and you'll then tell them your issue, and you'll be triaged based on that. We ask users what their issue is to begin with, and we move from there. We then use artificial intelligence to allocate the user to the most appropriate and available healthcare professional in real time. And our current match time between users and healthcare professionals is an average of 30 seconds. Finally, we use artificial intelligence to empower healthcare professionals. They're busy people, there isn't very many of them. How do we make the best use of their time? Simple things like preloading intros and outros during text consultations and creating consultation summaries during video consultations. And now we have beautiful visuals. So there you can see a dearth of healthcare professionals globally. Who is ABI? Like I was saying, we're a telehealth platform. We're currently in over 40 countries across the world, in 27 different languages, and we cover approximately 10 million lives. So we have pretty decent reach. We're HIPAA and GDPR compliant and ISO certified, which means we have high levels of compliance for data protection in terms of our patients' data. So like I said, we're all over the world, but today I'm going to talk to you about one specific deployment we had in the Ukraine and the results from that deployment. So in 2022, we were at the precipice of launching our service, which is a B2B model, with a partner in the Ukraine. But unfortunately, with the escalation of conflict, understandably, our partners' priorities changed. And they no longer needed to launch our service, or our service was no longer a priority for them. But we were poised to launch, so we said we'd go ahead and launch a B2C model where we would meet users where they are on popular chat apps such as WhatsApp, Line, Telegram, remove the paywall, and create demand for the service using Google search ads. And what we saw in our 2-month deployment was that the service was accessed over 700 times. And the median match time between users requesting a consultation and being matched with a healthcare professional was just 19 seconds. The average response time for doctors was 2 minutes and 28 seconds, and users rated the service an average of 4.6 out of 5 stars. So what did we see in terms of the cases that we saw come in? The breakdown of consultation was primarily through symptom checking, then pharmaceutical advice, and then reassurance and information. What might be of particular interest is that ABI usually deploys in kind of general practice settings. So we usually see most of our consultations around GP-related inquiries. But in this specific instance, we saw close to 40% of consultations center around OBGYN-related issues. That was then followed by dermatology, then followed by general practice, pediatrics, and urology. So what did we learn in this instance? We learned that using telehealth to enable continuity of access to healthcare professionals during the outbreak of escalation of conflict in the Ukraine was feasible and acceptable to users. However, people were reluctant to pay for the service when we reinstated the paywall, and that also paid demand generation, in our instance through Google search ads, was important to drive utilization of the service. So we have three key kind of recommendations out of this deployment for the future. The first is in terms of policy. Multilateral organizations and governments need to integrate telehealth into their emergency response plans for conflict situations. Interfaces like ABI that meet users where they are feasible and acceptable to people in conflict and low-resource regions. Secondly, in terms of practice, humanitarian agencies should complement their on-the-ground deployments in conflict zones, which are incredibly important, with digital healthcare to enable access for vulnerable populations. In this instance, we saw like women, who will have large uptakes of the service for both OBGYN-related issues and pediatric-related issues. And finally, funding is required to study in more depth what digital healthcare outcomes look like in the long run in conflict-related zones for access to care and disparities amongst displaced groups, etc. So it's been my pleasure to talk to you about this today. And if you have any questions, I'm happy to take them. And even more so, if you know of anyone who is interested in working with digital healthcare solutions, not only in conflict settings, but in low-resource settings and high-income settings, where there's an actual scalable solution, we'd be more than happy to talk. And most particularly at this moment in time, we're interested in working with partners who are based in Gaza and Lebanon to provide digital healthcare to people who are experiencing acute conflict at the moment. Thank you all very much.